Thank you very much, Dr. Mensah, for this perfect introduction. I must admit I'm just a simple dentist, and I feel very much honored to get the occasion here to talk about my subject amidst of a highly academic and scientific qualified. The subject of my presentation is these hyperactivated signaling pathways, RANTES CCL5. RANTES CCL5, I will explain it later, is a very unknown, or mostly unknown cytokine or chemokine. And we find this in osteopathy of jawbone. And I will specifically focus this RANTES overexpression in jawbone onto a group of breast cancer patients. So what is the dental aspect? The dental aspect is shown by this picture here from my friend Professor Thierry Boucaud from the United States. And what you can see here are hollow spaces, or called cavitations, inside the marrow space of the jawbone, of the mandibular jawbone here. And these spaces, these cavities or cavitations, are filled with fat, with fatty, degenerated osteonecrosis of jawbone. And this is why we call it FDOJ. If, or in a case, these fatty degenerated areas are closely situated to the trigeminal nerve, this process might induce the trigeminal nerve to neuralgia. And so in painful cases, this process is called neuralgia-inducing cavitational osteonecrosis, or in abbreviation NICO. So NICO and FDOJ are the same, but FDOJ is referring to the systemic effect, while NICO is only referring to the local painful effect of this process. Here you see, on the left panel, here you see an X-ray, and please check this area here. This is the retromolar area of a former wisdom tooth area. And the X-ray looks totally inconspicuous. Nevertheless, when we open this area, we find fatty lumps like this. And here we demonstrated with a contrast medium, we demonstrated the extension of this fatty degenerated area. So it's not just a pinball, it's really a big, big area. Now, what did we do? We had, 8 years ago, we had the idea to send these fatty lumps to a lab and to analyze here these fatty lumps for cytokine patterns, for inflammatory cytokine patterns. And I'm very glad to say that Mr. Wolfgang Meyer, who is sitting here at the table, was the first one in his lab in Munich who did for me these analysis, multiplex analysis. And this is the result. This is the outcome. And the outcome, you see, for 7 cytokines, FGF2, interleukin-1 receptor antagonist, 6, 8, MCP1, TNF-alpha. Here, this is not very much, but just only 1 cytokine had an extremely high overexpression, 5,218 picograms per milliliter, compared to a group of healthy jawbone. This is the norm, the normal jawbone, which had only, as a median from 19 samples, we had only 150 picograms. That means in this fatty degenerated and fatty altered jawbone, we have a 35-fold overexpression of just 1 cytokine, and this is called RANTES. It's very interesting that our good friend, inflammatory friend, TNF-alpha, we all know very well, has in healthy jawbone, has 11, and in these fatty degenerated jawbone areas, we have only 5.2. That means TNF-alpha is only half in these chronic fatty areas and compared to healthy jawbone. Same or similar with interleukin-6, you see. We have only, in fat, we have only 5.5. In normal, we have 100. So this is 20-fold lower than in healthy jawbone. What does this mean? This means all those acute cytokines, which we called the ignition of acute inflammatory processes, are blocked in this area. This is the reason, by the way, why these fatty degenerated osteonecrosis stays inside the jawbone of the patient for 10 years, for 20 years, without any pain. So the patient doesn't note this process. And as I showed just before, the dentist doesn't see the process on a normal dental X-ray. So this is the reason why everything I'm talking about, this subject now, is a bit sneaky and is mostly neglected in dentistry and medicine. So let's check what is Rantes, what can Rantes do in our body. Rantes is the old name, the more modern name is CCL5, chemotactic cytokine ligand number 5. And here are some citations from scientific papers. Rantes can have detrimental effects via the recruitment of immune cells that enhance inflammatory processes such as arthritis, atopic dermatitis, nephritis, colitis, and other disorders. So this Rantes seems to play a big role in many, many different diseases. Even here in diseases of central nervous system, is able to cause multiple sclerosis and Parkinson's disease. In targeting mast cells, Rantes causes allergies, alopecia again, and thyroid disorders. So why we are happy to find that is that by Rantes, obviously, we have a connection from unknown chronic inflammation in jawbone to systemic or autoimmune diseases. Now, this is a picture from Professor El Sava from the United States. And I love this picture because she's writing in her publications that Rantes CCL5 mediates a so-called cytokine crosstalk in the tumor microenvironment. So not only in arthritis and colitis and alopecia, Rantes plays a role, but also in the coming up of a tumor development. So we took and we focused in our patients, we focused on 23 breast cancer patients. Each of these breast cancer patients had at least one surgery in the jawbone. And we checked what is the medium contents of Rantes of these fatty lumps, of these fat samples we analyzed by this multiplex analysis. And you see the pattern is nearly the same as in the other 123 autoimmune diseased patients. Again, we have Rantes, healthy jawbone, 150. This is our baseline. Here in these 23 breast cancer patients, we had 5,123 picograms per milliliter in jawbone. Here, we see the distribution of these 23 patients, and you see that 3 of these breast cancer patients brought this machine. It's not a cheap machine, it costs a lot of money, built by Merck, Austin, Texas. here brought that machine to the limit of 10,000 picograms per milliliter. This is the medium, this should be the healthy, but each of these breast cancer patients was over the normal level of Rantis. Now the question is, as we focus on breast cancer, the question is, how is the role of Rantis and CCL5 in breast cancer development? Rantis has been associated as well with the induction or promotion of cancer. Here is the citation. Development of breast cancer is the potential ability of Rantis to act directly on the tumor cells and to promote progression of the tumor, clinical cancer. Analysis of Rantis expression demonstrates that expression of Rantis in breast tumor cells is elevated significantly. Or breast tumor cell-derived Rantis might promote breast cancer progression, cancer research. So we see Rantis is playing a detrimental role in breast cancer development. And now, here you see the median contents of Rantis, 5,123 picograms per milliliter, in these, as a mean, in these 23 breast cancer patients. And this should be the normal jawbone. And I found 2 publications in literature where they measured the Rantis contents in the breast cancer cells themselves. So one group here had a mean Rantis level, Rantis contents of 1,000 picogram. The other one found 800 Rantis in breast cancer cells. And in these breast cancer patients, we find in jawbone 5-fold higher Rantis expression than Rantis expression in breast cancer cells themselves. So this is not a proof that this might be the cause for that, but it's an interesting correlation between high Rantis in jawbone and just 5-fold lower, but nevertheless high contents in breast cancer cells themselves. So this here we have it 35-fold higher than in normal jawbone and 5-fold higher than in breast cancer tissues themselves. And now this is an interesting sentence I took out from a publication from Nature. You know, Nature is quite a good source for publication. The body's own stem cells stimulate cancer cells to mutate, to spread, and to form tumors in other organs. This enhanced metastatic ability is reversible and is dependent on the CCL5 Rantis signaling. What does this mean for us as a dentist? This means if we are able to eliminate the source of Rantis overexpression in jawbone, in these fatty degenerated jawbone areas, we diminish the Rantis signaling, and eventually we help the body to overcome here the metastatic ability and the metastatic induction of Rantis. This is the point, and the same publication is saying that Rantis is the switch or the trigger point or whatever you call it, which brings the breast cancer stem cells from the primary tumor to metastasis. And this is the disaster for these patients. Now, the question is there now a statistically to prove a correlation between Rantis in FDOJ samples and Rantis in serum in this group, small group of breast cancer patients? And we get a statistical positive correlation between the high Rantis in jawbone and the elevated Rantis level in serum. The problem is just that we can measure the Rantis level in serum several times, and look for progression, positive or negative. But in jawbone, of course, after surgery, we can measure it only once. This is the outcome. Here we have 5 breast cancer patients. Here you see these 5 breast cancer patients. And here, 1 month later, we measured the serum, the Rantes content of serum, and there is we find that the Rantes level in serum goes down after we eliminated the Rantes sources, the Rantes overexpression in jawbone. Thank you. This research was done by Mrs. Lechner, and she's doing all these statistic works. And again, back to the question, why is the subject I am talking to you widely unknown and widely neglected in medicine and dentistry? Here again, the normal X-ray of this wisdom tooth area. Here, another case, filled up with contrast medium, the hollow space inside the marrow of this mandible jawbone. And here you see this yellowish, fatty, this should be a spongal bone, but you don't see any bony trabeculae. It's just a lump of fat. Now, I would like to present you a single case. This is a lady, she is 48 years old, with a double recurrent breast cancer. She was sent to our clinic because the classic oncologist said, we are at the end with our treatment, we can't help you anymore. So we checked for silent inflammation in jawbone. This is the area, retromolar area again. We did the surgery there, sent this sample of fat to the pathologist, and the pathologist called me and said, oh my God, here we have inside the jawbone, we have a metastasis of adenocarcinoma of breast cancer. So we had metastasizing breast cancer cells in jawbone in this area, and parallel to that, and enforcing our hypothesis, we had a Rantes contents in this jawbone of 4,600 picograms per milliliter. Again, a 25-fold overexpression of these Rantes in this area. This is an interesting case, and I show you here these intrasurgical pictures. I'm very sorry that I have to do this after lunch. I hope everybody can have that without any incidents. So here you see we folded back the mucoperiosteal flap. We made a window into the cortical bone, and opening this medullary space, we found here one of these huge fatty lumps, taken out this one, and this fat lump was sent to the lab and to the pathologist. And this is the outcome, again here, metastasis, metastasizing cells, and high Rantes input. Now the question is, does Rantes also play a role in the metastasis of breast cancer? Not only in the primary tumor, also in the metastasizing phase of a breast cancer. Rantes can also increase the metastatic potential of cancer cells. Breast cells stimulate secretion of Rantes and so on. To enhance their motility, invasion, and metastasis, again a citation from Nature, or this increased propensity towards metastasis is reversible and dependent on the Rantes signaling. And this is the reason why I pled, and I'm glad when you have patients with breast cancer in our clinic, I'm glad for the surgical elimination in case patients have these fatty degenerated processes in jawbone. By the way, I go back, By the way, this patient I showed you was in my clinic 9 years ago. We did 4 surgeries on her. And as she's from Vienna, I sent her to Dr. Hubmann, who is also in Vienna, and Dr. Hubmann is teaching in the workshop this afternoon. And Dr. Hubmann is treating this lady, double recurrent breast cancer, metastasizing cells of breast cancer in jawbone. He's treating her now for 9 years with Labolife, and she is happily living and nearly healthy. And this is an amazing outcome. Also interesting is when you go to Google Scholar, and when you add, let's say, breast cancer and Rantes CCL5 in Google Scholar, you get, for breast cancer, you get 5,150 studies. When you do it with, let's say, multiple sclerosis and Rantes CCL5, you get 5,140 studies. If you go to depression, where is depression? Here, depression, you get 2,440. That means we have also a connection between central nervous system and Rantes. But when you add jawbone and Rantes CCL5, you get only 32 publications, and 14 are from us. So this is a poor outcome. And it's a poor outcome because obviously in many, many autoimmune diseases and severe diseases, Rantes CCL5 plays a well-known role in medicine, but dentistry does not care about this Rantes sources in jawbone. So the next question is here, where is the connection of my Rantes studies to micro-immunotherapy? And we tried, this was my personal event about 10 years, 15 years ago. I saw there is a company, Labolife, who is selling remedies which contain Rantes. And now here we tried with Rantes, we took Rantes as a single remedy in ultra-low doses and gave this Rantes patients immediately after the surgical cleaning of the FDOJ and checked 1 month later for Rantes in serum and compared these values of Rantes in serum just before the surgery and 1 month later with including ultra-low dose of Rantes. And we have statistically highly significant lowering of Rantes in serum. And this is basically what we want. We do not only want to eliminate mechanically these Rantes tissue or these Rantes sources from jawbone. We want to give as a systemic benefit the patient a lower Rantes level in serum. So what's the take-home message I want to give you after this lecture? The problem is the wound healing in jawbone after wisdom tooth surgery, after tooth extractions or whatever dentists do to the jawbone, goes from acute infection, we know this, 1 week you have pain and the cheek and gonflage, and then this acute infection does not go to a complete healing, it goes back to chronic or silent inflammation, and this chronic or silent inflammation might be the source of a consistent and over years and years working Rantes CCL5 overexpression. So to treat this Rantes overexpression also on an immunological level, the idea is by ultra-low dose of RANTES, by the application of ultra-low-dose RANTES, we get a desensitization of this RANTES signaling pathways created by the jawbone. And this is my advice, to give complementary microimmunotherapy. Thank you very much for your attention.